What would you say if I told you you can virtually eliminate the possibility of you ever having another cavity in a tooth for the rest of your life? Even more importantly, what if I told you that you could help prevent your children or grandchildren from ever having another cavity or ever having their first cavity, for that matter? What if I told you that your children and grandchildren, if they're below the age of 10 or 12, will probably never have to have the painful surgical procedure of having their wisdom teeth cut out?
Yeah, so my name's Dr. STEPHEN LIN, and I'm a trained practicing dentist. I'm in my clinic at the moment, and my path in my career has been following the story of how food and nutrition affects the oral cavity and the dental diseases that we see very commonly in society today. Yeah, it's difficult. There's a huge learning gap, and there's so much research that has come out in the last 10 to 20 years. A lot of professionals don't have the time or haven't had the opportunity to be able to educate themselves in that. And then the application into practice is very difficult. Dental practice, for example, is very regimented, and the practices are designed like that because things go wrong. It's difficult to practice in the mouth. It's hard to put restorations in. Dental disease is a difficult problem to fix, and that's why dentists are very set in their ways, or the training is very set in its ways. So I'm seeing a patient with moderate to severe gum disease in their mid to late 30s, and the issue is that their blood sugars are out of control, and they're pre-diabetic. They haven't been diagnosed by their doc yet, and until they get that diagnosis and we start understanding that their diet is controlling their or pushing them down the road to insulin resistance, then I'm never going to be able to control the gum disease.
And you may not know this about me, doctor, but when I started this health improvement journey for myself, I was morbidly obese, pre-diabetic, had severe gastric reflux, and I had a substantial amount of gingivitis or gum disease. And as I've kind of progressed from eating the standard American diet and moved kind of to more ancestral, primal, paleo, and now ketogenic, and then for the last 14 months, I've been almost exclusively a fatty meat carnivore, my gum disease is completely gone.
Yeah, so it's an excellent question, actually, because a lot of people have this issue. And if they go on a healing journey, they'll actually find that the tissues settle down and then you don't have active disease. Gingivitis is an inflammation of the gum tissue. Gum disease is where it progresses to periodontitis, and that's a chronic infection of the bone. And so if you floss your teeth, or even if you brush and you see some blood, that's inflammation of the gum tissue and gingivitis. That can progress to periodontitis. And all periodontitis is an autoimmune reaction of the body to break down the tissues, the collagen ligament that connects the gums to the bone. And so what happens if you have it long enough, the bone starts to run away. And this is what dentists will measure in their offices, and they'll tell patients, and they'll clean around that interface between around the ligament and the root of the tooth to make sure that calcified plaque isn't getting built up there. But so what happens if you lose attachment and you lose bone around the tooth? It is difficult to regrow, but you can stop the process. For most people, if you stop the process and you prevent it from going further, yes, the tissue will resolve at its point of loss. You're not going to grow back. You can gain some attachment back. So the measurements that the dentists take, they'll measure the actual pocket. You can gain some attachment, which is how the gum reconnects the ligament to the tooth, but you won't regrow the bone. So some of those measurements will be with you for life. But that's fine. That's okay, because that's where you're at. That's your journey, and your teeth are going to be okay because you're continuing to to give them the raw materials they need to maintain both teeth. The main thing is that inflammation profile is gone and it's not progressing. One of the most important precursors on how humans should eat is how the jaws grow. Because when we have crooked teeth and crooked jaws, these sit in the maxilla and mandibular bone. And the maxilla bone holds your airways. These muscles connect into your craniofacial system that are the base of your brain. So when our teeth are crooked, which is a modern agriculturally driven, so when we move into industrial society, then we get crooked teeth. And this becomes between 7 to 12, early adolescence, when kids have braces. That's a jaw growth issue. It's a sign they're not getting enough of the nutrients. And this is why we've got to recalibrate our idea of eating to stop thinking about calories and silly things like that and macronutrients. And we need to think about what are the nutrients our body needs. And so you mentioned wisdom teeth impactions. So wisdom teeth impactions is just a jaw growth issue at late adolescence when the third molars are trying to grow in and the jaw hasn't grown back and out enough. So it's all a craniofacial growth issue. And this is how foods drive the calcium metabolism, putting calcium into bones and teeth. You know, your body will do that naturally. This is all based on the work of a dentist that went around the world in the 30s and showed that when people eat the modern diet, their jaws and teeth deteriorate. Anthropologists laugh when you ask about dental disease in population. It doesn't exist because people eat the proper human diet. It doesn't happen. And he said it was sugar, vegetable oils, and refined flour. Refined carbohydrates, which nearly makes up a huge percentage of the modern diet now. And a sneaky one that in the US is a huge issue too, but a problem across the world is the refined vegetable oils. And so these ones sneak in, they're healthily packaged, but what they do is they stop your body from absorbing the nutrients that your bones and teeth need. Because we have a packaging system that goes around the body that delivers, and they're fat-soluble vitamins. That's the critical piece to your diet that puts calcium into bones and teeth, creates immunity to tooth decay, helps kids grow their jaw, because these are fat-soluble vitamins. And so the most common ones we know is vitamin A and vitamin D. Vitamin D is a hormone, and vitamin D stimulates insulin-like growth factor, growth hormone in the body. And so when kids are growing, the body needs all these nutrients for the jaw to grow and widen, and then all of the calcium to go into the bones and teeth. And so the last factor that Price found was vitamin K2. So these three things work very neatly together in the body. They're found in animal foods. So he actually measured the food in all of these continents around the world and compared it to the American diet back in the 30s. So you can imagine how much we've stripped out since then. And he was showing that the traditional human diet was 10 to 20 times richer in fat-soluble vitamins A, D, and activator X. K2 was actually the activator X, and it's this huge story that we've missed. You won't find it on any food packaging. One of the most important nutrients that you'll never hear about, found in organ meats, in egg yolks, and grass-raised dairy, in fermented foods. There's two types of it, but we just don't get it in the modern diet, and it's critical for healthy teeth, healthy jaws, and developing kids. So preventing braces, preventing wisdom teeth extractions, we can do it all if we have these nutrients in the body. The body does it itself. It's amazing.
Price went and he looked at indigenous populations that were really untouched by the modern Western diet. And these people had beautiful teeth. They had well-developed maxilla and mandibles. They were nose breathers, not mouth breathers. Human skulls, further back than 15,000 years, right? There's literally no cavities in the teeth, and there's never a dental abscess because that shows up in the fossilized remains of the maxilla. But about the time that we started farming and had access to lots of grains and lots of starchy foods, that's when you start seeing severe dental abscesses and just teeth worn down and cavitated until they're just no longer usable. But we're seeing the same thing. Before you add sugars and before you add grains and before you add starchy tubers and in my opinion, a lot of the modern fruit that's been crossbred to be basically just a big sack of sugar, before you start eating that stuff, dental abscesses are unheard of, and cavities in the teeth are very, very, very rare. And I think there are many doctors and dentists who they don't think about that. Like, no, it's this cavity that you're about to fill and get paid $150 for, it was caused by the diet that this child ate.
And he found that as soon as people ate that modern diet, right bang in one generation, the teeth and jaws deteriorated.
But people think of their bones like rocks. Like they are what they are. You can't improve them. They just exist. But the truth of the matter is that all of your bones in your body at any age are very fluid, and you can strengthen them or you can weaken them, both with the diet that you eat and the diet that you should be eating, and with exercise.
The jaws and teeth are a living, breathing entity. They're not a porcelain vase that shatter when, by accident. They break because we don't give them the right nutrients. And if we get these kids the right foods, and also goes back to prenatal nutrition as well. So we need to feed ourselves the right thing. mothers who are nursing their child need to make sure these foods are going to them, because it's, vitamin D deficiency, for example, we know in the literature translates through the breast milk. So breast milk is not all the same, and that we need to be nourishing ourselves as well as our children. But then for kids, the great message is that teeth have an immune system. So if you feed them these fat soluble vitamins, he hasn't had a piece of fruit in his life. All parents don't necessarily have to do this, but similar to your principles, you start them young, and that's what they go for. He eats eggs every morning. He's never had a refined carbohydrate. But so the main principle is that they have to have the fat soluble vitamins. So they need to get these. You have to work in the fatty meats, you have to work in the organ meats, you have to work in the egg yolks, whole fat dairy if they tolerate it, and that's what provides. Their bodies are the literal sponge for these things. It'll create the physiological barrier to tooth decay. So if your child has a hole in their tooth, you can change that. There are cells inside the tooth called the odontoblasts, which are very, very similar to osteoblasts to create bone, and they're an immune cell. And so if they're run by these nutrients, vitamin A, vitamin D, and vitamin K2, so you feed them the protective factors and you remove the harmful factors, and the bodies will start to do it itself. So for tooth decay, that's the first sign of how we're managing calcium balance in a young child. Now, as they grow and develop, you'll start to see whether the teeth have space to come in. Between 6 and 12, for example, but this happens right even when we have just baby teeth, their jaws are developing, and you have 32 human teeth raring to come in. So at 6 and 7, they start to grow. And so what you need to watch is that functionally, they're helping this craniofacial development. We can intervene, we can help the jaws grow. That's what we do in our clinic. We prevent braces, we get to the problem before, and it's all to do with breathing, because when we nasal breathe, and which expands the maxilla, which creates the platform for the upper teeth, which creates a platform for the whole entire craniofacial system, then we create an expansive growth pattern that will then start to create a posture where the child is not mouth breathing. Because if the child mouth breathes, it stunts the growth of the jaw, the maxilla, the roof of the mouth. And what happens is that then you get crooked teeth. If you watch your child, if they're open mouth posture, we need to teach them to breathe through the nose. You really need to watch their sleep, because if they breathe through the mouth through 8 hours of night, this is when all the growth and development is happening. It's where the brain needs all that nitric oxide rich air that goes through the nasal sinuses. If this is all corrected, the nutrients, the breathing, the last factor is the tongue posture. So the craniofacial posture, so tongue to the roof of the mouth, and it's kind of this kind of movement. It's a suction to the roof of the mouth, and that's right back to the soft palate. When you swallow, that creates an upward-outward movement that supports the neck and cervical spine, supports the airway, the oropharyngeal, the throat holds open. You breathe correctly, you create posture. This is why singers have such great craniofacial structure and actors, because they use their voices so well, because their breathing and their airway system is all working well. So when all of those things come together, a child grows and develops. The nutrients that they eat and the air they breathe and the sleep that they get, all of those things come together, and they'll never have a tooth issue. They'll never have wisdom teeth impactions. They won't need braces. Some kids, they have a tongue tie when they're born, and it prevents them lifting the tongue to the roof of the mouth. The early pediatricians need to get on top of, and the parents need to understand if kids have trouble breastfeeding, it might be a lingual freedom. All of these things come together in craniofacial growth, but it's largely driven by food, stripping out those nutrient poor foods and putting in those nutrient dense animal fat soluble vitamin rich foods.
Number one, you got to remove the things that are not nourishing the teeth and that are actually causing active tooth damage, like sugars, like grains, like industrial seed oils, any high sugar food. Number two, you've got to add foods that give you everything that the odontoblasts need to not only build teeth, but maybe even to repair teeth. Children, especially when their mandible and their maxilla are developing, when they're still growing, they really need to have foods that they need to gnaw on and chew on, like we've done for the last 250,000 years. That stress on the jaw bones actually helps the jaw bones develop. Have I got you so far?
That physical factor, which is the things I spoke about, is the breathing and the tongue posture, but the chewing, it's a musculoskeletal joint. So people go to the gym, you go and work out to build a strong musculoskeletal joint. It's the same with the jaw. So kids need to chew on raw, raw foods, bones. They need to rip and tear. This is what we're designed to do. When you look at the anthropological records, we just don't have these jawbones anymore. And when you look at kids today, when wisdom, some teeth are impacted now and they need to come out because they get infected, right? So, but when you take when you lift the gum up and you look at the bone, it's paper thin. It's literally, you touch it with a surgical handpiece and it basically dissolves. The bone that people are putting down in their jaws today isn't the same because the body does not have the raw nutrients to place that calcium in. The calcium metabolism depends on vitamin D, vitamin A, and vitamin K2, and we're not getting enough of these foods. And a lot of it is foods that aren't very popular, like cod liver oil, which our grandparents all tried to give to our parents. This is where vitamin D was discovered, when in the rickets epidemic. Then in later life, it becomes osteoporosis. So why haven't we connected this to an actionable, disease process we can prevent in the mouth by eating the right foods?